and welcome to Joy in Our Town. I'm your host, Vanessa Rose. So happy you decided to tune in and join us for another great edition today. Today we are speaking about drugs and alcohol. This is something that affects a lot of people's lives. It may not affect your life personally, but it's very possible you may know someone or have known someone that has been affected by drugs and alcohol at some point. We are very happy to be joined today by Jerry L. Law. He is it's a D-Min, which stands for, again, for
Doctor of Ministry.
Doctorate of Ministry, very good. And he is a counselor and an interventionist. Thank you so much for joining us today, Jerry.
It's my pleasure, Vanessa. Thanks for having me on.
So great to I know that you have a world of knowledge to share with our viewers, and we're going to have some great things to share. But before we get started, if you wouldn't mind just telling them a little bit about who you are.
Sure, I'd be happy to. Well, my background is, as we were talking a little earlier, sometimes I refer to it as eclectic. After a 20-year career in the corporate world, I transitioned into the work that I'm doing now, and I've been doing this for almost 10 years. I work as a counselor, doing marriage and family counseling, but I specialize in the field of drug and alcohol dependency. I'm a master certified drug, alcohol, and addictions counselor, as well as a registered addiction specialist. In addition to that, it's my great privilege to work as an interventionist, helping families come together and through a very planned and prepared process, get ready to sit down with their loved one who's in trouble, typically drugs or alcohol or perhaps some other problems, and they're either in denial about that or very well aware of their need for help but unwilling to accept some help. And through this process called intervention based on love, care, and concern, get the family ready to be able to sit down with their loved one and present the truth. And the truth is, we love you. But we care about you, but we're concerned. And the truth is, you need some help. And we're here today to offer you that help. And if you'll accept the help that we're offering, there are fabulous, wonderful consequences, starting with you getting the help you need, but then we will also, as a family, we're going to get the help that we need so that we can be a support system to you. But ultimately, this is your choice. And if you choose not to accept this help, then you need to understand the choices, the decisions we're making and putting in place today and how our relationship with you is going to have to change. Because we love you, not because we don't. We love you enough to be able to say to you, here's the help that's available, but if you don't choose that help, you need to understand the new boundaries we're putting in place because what's been happening isn't working and we're going to have to make a change. Wow. So that's the intervention process in a nutshell.
Wow, and so this is something you've been doing for a long time?
I've been doing this now for about 10 years.
Wow, so I think you've seen a few cases then here and there.
I have indeed.
Yes, you've seen it firsthand and been hands-on in the process. But thank you again so much for taking your time to be here today, Jerry, to share with our viewing audience. Thank you so much at home for watching. Today we are covering drugs and alcohol, and our first topic is addiction. Disease or choice. Before we cover the disease or choice, what is addiction?
Well, addiction has a number of definitions. The medical community will define addiction this way. They will refer to it as primary, chronic, progressive, and left unchecked, fatal. The treatment field, on the other hand, uses a slightly different definition, which they refer to addiction as being a bio, psycho, social, spiritual disease or disorder. It's got all of these components, all of these aspects going on. The biological piece is primarily neurological. Changes that have taken place and continue to take place neurologically in the brain. Psychologically, we're talking primarily about behaviors, the ongoing bizarre and unusual behaviors that an addict will display. Allegedly, Einstein is the one who told us that insanity is doing the same thing over and over and expecting a different result. Well, nowhere do we see that played out any more powerfully or profoundly than in the life of an addict. Thirdly, there's the social aspect. Addicts tend to isolate and withdraw and pull away from the most important people in their lives. Conversely, they begin to associate with, affiliate with, hang out with people who do what they do, people who in the past they would never have associated with. Then there's the spiritual aspect, and by that I'm not talking about religion so much as I'm talking about the mind-body connection. who we are as individuals on the inside, our value system, our morals, and so forth, all terribly impacted by the disease, the disorder of addiction. So it's typically thought of as being a biopsychosocial spiritual disease.
Try to say that 3 times fast. That's a mouthful. My goodness, you truly are a book of knowledge. How just in that little brief description you just gave of what addiction is. That being said, is addiction to drugs and alcohol, is that a disease or is it a matter of choice?
The question is great, Vanessa, and it's asked all the time. Is it a disease or is it choice? And the answer is yes. It's all of these things. Again, back to that biopsychosocial spiritual model, it's everything. If a person chooses never to consume mood-altering chemicals, clearly they're not going to become an addict to mood-altering chemicals. So there's the choice aspect. No one puts a gun to the head of that person and says, you must drink alcohol. That's a choice. But at the same time, that individual may consume mood-altering chemicals long enough or for an intensity level that they cross a line. Sometimes we talk about flipping the switch or crossing the line into true addiction. And addiction is, in fact, a disease. It is no longer just a matter of choice, it is both. One of my favorite authors refers to it as it is a disease of choice. So really it is both.
And it's something, so whenever you do recover from drugs and alcohol, is there ever a true recovery then? Or is that something that you're continuously fighting?
You know, that's debated.
Okay.
There are those who will say, absolutely, you can recover. Most people in recovery use the word, will refer to themselves as being in recovery. They have crossed that line into true chemical dependency. And the neurological and biological changes have taken place so that to stay well, they choose abstinence for the rest of their life. Here's a great little analogy. And the first time I heard it, I really appreciated it. If you have a cucumber and you put that cucumber in a jar of brine and you leave it there long enough, what happens?
It becomes pickles.
It becomes a pickle.
Yes.
Right? Now, you can take that pickle out of the sauce and you can put it in a jar of water. You can put it in a baggie and put it in the fridge and leave it there forever. One thing will never happen. It will never revert back to being a cucumber. It is a pickle. It always will be a pickle. All right? So the analogy is that people who have developed true addiction, they're pickles. And so if they take the risk of going back in the sauce, there's a high likelihood of ongoing use and relapse. So the real solution is stay out of the sauce. But it's okay to be a pickle.
But you just have to realize that you are.
And learn tools and techniques for successful living in recovery.
How does somebody know if they are an addict or if a loved one is an addict? What are the signs? This is something that probably a lot of people ask because they don't know.
Absolutely. There is a clinical definition, a book that's referred to as the Diagnostic and Statistical Manual version 5, the DSM-5, provides a clinical definition that clinicians can use to determine has this person crossed over into alcoholism or chemical dependency. And there's a long list of behaviors and symptoms. I'll give you 3 or 4 that we typically see when a person has crossed that line. One is that person has lost control. Now, it doesn't necessarily mean they've lost control of life. It means they've lost control over the use of these mood-altering chemicals. At one point, they had control. They could have a drink or two. They might be able to, if such a thing exists, recreationally use illegal narcotics or cocaine or meth. But at this point, they've lost that control. They can't just use. They can't just drink. Once they begin drinking or using, it triggers that biopsychosocial mechanism within them, and no one knows where it will stop. They'll go until they run out, till they pass out, until they crash the car, until there's nothing left. They've lost that choice. So there's the loss of control. Secondly, we see a preoccupation. Now, a normal consumer of mood-altering chemicals, we'll use alcohol here. A normal drinker goes to the football game and has a hot dog and a beer and says, that's it. The person who's the addict, that's no longer the way they're thinking. Their thinking is, get it, have it, hide it, steal it. The very thought of not having access to their drug of choice is terrifying. So there's a preoccupation with getting, using, having going on. Thirdly, we will see continued use despite the consequences. You know, the normal drinker has a bad experience one time and says, wow, I've learned my lesson, I won't do this again. Maybe they had a DUI, it was a one-time thing. They don't ever go there again. These individuals continue to use despite the consequences. I know an individual who's been in recovery for over 30 years.
Wow.
But back in the day when he was drinking, I don't remember how many DUIs he got total, but his second DUI arrest happened while driving home from a court appearance for his first DUI. Okay, that's a different person. This is a different, the consequences are no longer driving behavior change.
Wow.
Okay, one last one. And we tend to use the word denial in the addiction field quite a bit, or distorted perception. The people around them see it for what it is, they don't. And they will deny it, and they'll use defense mechanisms to say, well, it really isn't that. And so they've got a lot of denial going on. And I think denial, Vanessa, has at least three faces. One face is the obvious, well, I don't have a problem. Another face is, well, yeah, I might have a problem, but I can manage it. I'm special. And then the third face of denial is the victim. Poor me, woe is me. No one could help me. I'm beyond hope or help. So that denial that comes out is another indicator. So those are three or four of the symptoms and behaviors that are looked at to see, and if there's no other biological reasoning for these behaviors, and it can be tied directly to their use of mood-altering chemicals, it's a pretty good indication that this has crossed the line.
One thing you mentioned was somebody that goes to a football game to have a beer and a hot dog, and then somebody who they go there with the intention that they have to have a drink.
Yes.
If somebody is experiencing that personally in their life, and they're the pickle, or they're the cucumber in the jar, they haven't turned into a pickle yet, is there a way that they can gain control over that so that it doesn't become that? That's
a fabulous question. Quite often as I describe the journey into chemical dependency, which is the term I prefer over addiction, addiction has become an overused word. We talk about being addicted from everything to everything from alcohol to shoes and chocolate, and so really chemical dependency. That journey into chemical dependency, I think, runs along a spectrum. And it starts down here with the word use. That's the guy who goes out and has a glass of wine with the dinner, and that's all there is to it, because they know they got to drive home and they're in control. This other end is that addict, that chemical dependency. Points along the way. Kind of the midpoint is the word abuse. Now that's the person who is consuming too much and it's causing problems in their life, but they recognize it. And the consequences gets their attention. And they suddenly realize, I'm in trouble. I need help. And they reach out to a counselor, they go into an outpatient treatment program, they recognize that need for help, and they are able to move back on that progression rather than forward. So yes, it does happen that people can reach that point and move back because they haven't truly crossed over into full-on dependency.
Wow, there's quite a few more questions I wanted to ask you about this, but unfortunately our time is up in the first segment. But
no problem.
Just so much wonderful information. Thank you so much, Jerry.
It's a delight.
And thank you so much at home for watching. We have showed Jerry's information periodically at the bottom of the screen. If you have any questions, I know that he has a book of knowledge, and please feel free to check out those resources and look at them and see if there's any questions you would like answered. Thank you so much at home for watching. We will be right back after this short message.
Oh, hey, bud. Where are you headed?
Just gonna hang out.
With Gary and Todd?
Yeah?
I've been meaning to ask you, is there any drinking going on in this crowd?
No?
If any of your buddies ever pressure you to take a drink, just tell them you promised your dad you wouldn't. I'd do anything to keep you safe.
Okay, I will.
I hope this is working.
I promise. Love you too, Dad.
They really do hear you. For tips on what to say, visit underagedrinking.samhsa.gov.
Hello and welcome back to Joy in Our Town. I'm your host, Vanessa Rose. So happy you decided to tune in and join us today. And we have had some wonderful information for you already on this program. And we are going to continue today with Jerry L. Law. He is a counselor and interventionist. Thank you so much for staying with us, Jerry.
My pleasure, Vanessa. Thank you.
So great to have you here. So much great information he just shared about addiction. And now we are going to speak about intervention and the first steps to recovery. One thing that we've all seen a television show or a movie, and we see this very dramatic thing happening. And is that really the way interventions take place?
Well, in some ways, Vanessa, yes, but in more ways, no. What the television shows tend to focus on is the addiction, the horrors of the life of that individual and what they're experiencing. And then they kind of stumble into this little 90-second thing called an intervention. The reality is, a lot of planning, preparation, and so forth goes into getting ready for that moment when we do, in fact, sit down with that individual to present the offer for help.
Wow. And so it's something that, an intervention, what is an intervention?
Sure. An intervention, in its simplest terms, is anything that breaks the cycle of what's going on. Now, there are a number of different styles and protocols for intervention being practiced throughout the United States. About 40 years ago, almost 50 years ago now, the intervention as we understand it today was pioneered by an Episcopal priest by the name of Dr. Vernon Johnson. He was in recovery himself and discovered this or developed this protocol for intervention that most interventionists follow to some degree, though we all tend to add our own style and personality to it. The bottom line is it's about helping that family. My client is the family. The family hires me to come in and help them present this offer to their loved one. But it's so much more than just presenting the offer to the loved one. It's also about educating the family, helping them understand what's really going on in the life of our loved one, helping them to change the behaviors that they've been involved in, the enabling, the manipulation that's been going on, how to come together and unite as a family to sit down with their loved one and present that offer. A lot of planning, a lot of preparation goes into that. The last thing we want is to just stumble into something that gets out of control. So in my case, I will have spent 10, 12 hours face-to-face with that team before we ever sit down with their loved one, training them on not only what to say, but how to say it, training them and preparing them to overcome objections that their loved one may bring up, preparing for that person's arrival. What do we do when they walk in the room? Behind the scenes, we have a treatment program already lined up. We use the term a bed hold is in place, so that when that person says yes that day, it's time to go. It's not time to consider it or now go find a treatment program. It's time to go. And my job is to help that family through every phase of that, as well as continuing to work with them while their loved one is in treatment.
Wow, well, it's an admirable job then. You're helping people, and
it's the best.
Oh my goodness! And one word that you used was enabling.
Yes.
And that's something that a lot of family members probably unknowingly do.
Yes.
How do you draw that line though between tough love and intervention? Because you probably have to give an ultimatum at some point that says we're here or not.
Yeah. Enabling always starts as helping. You love this person, you're concerned for your family member, and you want to help them. It crosses the line when it's no longer helping and we begin to live other people's lives for them. We begin to provide ways in which they can do the things they're doing. We pay their rent so they can spend their money on drugs and alcohol. We bail them out of the consequences. They get that DUI and we hire the best lawyer in town to expunge the DUI rather than letting them feel the consequences of their choices and behaviors. So it starts always from a position of love and wanting to help, but it crosses over into doing just the opposite.
And so, do you have to draw a line as an interventionist
Yes.
working with people? What kind of ultimatums would a family give?
The ultimatums, Vanessa, are going to depend on the specific relationships that each member of the team has with that individual. A friend, the bottom line may be, I love you, but from this point forward, the only conversations we're going to have is about you going to get treatment. And every time you call me, I'm going to be my first question. You ready to go to treatment? And if your answer is no, I'm going to hang up because we don't have anything else to talk about. A parent, on the other hand, who has been enabling financially, they may have to say, we're not paying the rent, we're not paying the car payment, we're not paying your insurance unless you go get treatment. A spouse may have to say to their loved one or their spouse, I'm moving out. I love you, not divorcing you, but I'm not going to live with you until you get healthy and well, and I'm taking the kids with me. So consequences, bottom lines, will depend on the relationship each member of that team has with the loved one.
So it sounds like you're removing the comfort from their life.
Exactly.
You're
Until
making
they
it
feel
uncomfortable.
until the discomfort of the disease is greater than the discomfort of all of the manipulation and so forth that's going on, nothing will change.
Wow.
In recovery, we often say, if nothing changes, nothing will change.
Wow. Well, there you are. It's so simple, but so...
It's very simple and yet very profound.
It is. An interventionist is, how do you, well, first of all, before, how do you find one?
Yes.
Is it suggested that you use an interventionist, or is this something a family can do on their own?
A family can certainly do it on their own. I suggest and advocate to get a professional involved. If, on the other hand, you're only talking to a user versus someone who has a true
Full addiction.
that's different.
Okay.
When you're talking to this individual down here on this end of the spectrum, rational, reasonable, logical talk is moot. It just doesn't work. With this person, it does. So if you've got this person on your hands, I think it's wise to get a professional involved. There are people out there doing interventions that frankly shouldn't be. They're not credentialed, they're not trained. I would always advocate hiring a credentialed, trained interventionist. People can go to the Association of Intervention Specialists website,
Okay.
and there they'll find members by state who are credentialed. They carry at least the BRI 1 or 2 credential, which is Board Registered Interventionist, or I should say, they carry the Certified Interventionist Professional or Certified Intervention Professional credential, which is issued by the Pennsylvania Board of Certification.
Okay.
So you do want to find someone that is credentialed and certified.
Because this is something you may only have an opportunity once.
Absolutely. We may have one shot at this, and we don't want to mess it up.
And that's something that you had mentioned earlier, and I was asking you, was if you do it as a family and you keep doing something and it's not working, then you don't want to drive that person to where they're no longer reachable or they won't talk to you anymore.
That's correct.
Can you reach that point with a family member?
Oh,
to where they'll cut
absolutely.
you off?
Oh, absolutely. And quite often I'll do interventions where the family has almost no communication left with their loved one.
If somebody has a loved one, a husband, a wife, a child, a parent that they see is in that user category, how should they approach that? If they see maybe they have a little bit of a concern, they see maybe they're drinking a little too much or they're doing something, how should they approach that?
Sure, I advocate that you sit down with your loved one and share your feelings, not from a you're bad perspective, but from a here's what I'm feeling. These are the facts, this is your behavior, and this is how I'm feeling about it, and I'm worried, I'm concerned. What can I do to help you? Are you willing to go see a counselor? I'll go with you, someone who is specifically trained in addiction counseling. Provide that resource, provide that opportunity to get some help.
And not to get too, I know we're speaking about drugs and alcohol today, but you can have an intervention for all sorts of addictions.
Absolutely. I've done interventions for sexual compulsivity, compulsive gambling, drugs, alcohol, eating disorders. I specialize in interventions for eating disorders.
Wow, that must be a tough one. That must be.
Well,
they're
yes,
all
but really no more than
any other addiction.
Yeah, it's all about breaking this cycle of destructive behavior in the individual and the family.
Do you have an example of a case that you worked with that ended up having a great outcome?
Oh, sure. Let me tell you one of my favorite stories. I did an intervention here in Arizona about 3 years ago. And this was for a young lady. She was 19 years old, and she had both an addiction to heroin and crystal meth.
Oh, my goodness.
The intervention itself went fine. She chose not to go to treatment. She was very angry and called me all kinds of lovely things, and that's okay. She refused to go to treatment. Her family then put in place new boundaries. This is the way it's going to be. So for about 2 weeks, the family was calling me every day, saying, what do we do? What do we do? What do we do? She's crying out and demands that we bail her out of these situations. So I continued to coach them in maintaining those boundaries. Ultimately, she decided, I guess the only choice I've got is to go to treatment. So she did. She went to treatment. She was only there for a couple of weeks, and she was discharged for bad behavior. Called her parents and said, you have to rescue me, and they said no. And so I coached them once again on how to maintain these boundaries. She went into a second treatment program. And about 10 days in, the light came on. And somehow she began to embrace what she was learning in the treatment program. And so 4 months later, approximately after the intervention, I was just coming back from an intervention. I was walking through the airport, and my cell phone rang. And I answered it, and this sweet little voice said, is this Jerry? And I said, yes, it is. And she said, well, you may not remember me, but and gave her name from that intervention. And I said, oh, honey, I'll never forget you. And she said, well, I'm calling for 2 reasons. Number one is to tell you I'm so sorry for all the things I called you. Wow. And number 2 is to tell you that tomorrow I pick up my 90-day medallion for sobriety, and I just wanted to share that with you.
How wonderful.
It doesn't get any better than that.
Thank you for what you do in our community.
Oh, it's my pleasure.
I know that addiction and drugs and alcohol is not a victimless crime. It affects so many people and so many families. And for any of you watching, I know that if you go to Jerry's website, there's all kinds of resources there. If you're struggling with an addiction or have a friend that is, there's lots of resources. Please reach out to somebody and know you're not alone. This is not something you're alone in. But thank you so much, Jerry, for joining us today.
Thank you for having me.
Such a pleasure to have you. I know that you at home have enjoyed having him today. Thank you so much for watching Joy in Our Town, and we look forward to seeing you next time right here. Have a blessed day.
This program has been sponsored by the Trinity Broadcasting Network and is made possible by your telethon dollars. Your continual support can keep Joy in Our Town coming to your home every week. Write to Joy in Our Town, Post Office Box A, Santa Ana, California, 92711.